you have to prepare a class 2 restoration for silver amalgam restoration. So the question can be asked, what is the definition of tooth preparation? So you should all know the definition of tooth preparation. So tooth preparation is mechanical alteration of defective, injured or diseased tooth in order to best receive a restorative material which will re-establish the healthy state of the tooth, including aesthetics wherever needed, along with the normal form and function. So class 2 restoration means it's based on treatment and restoration designs. Class 2 is according to our Dr. G.V. Black's tooth preparation cavity classification, and it means carries on proximal surface of posterior teeth, mainly premolars, proximal surface of premolars and molars. So along with the occlusal pit and fissure cavity, class 2 also involves proximal smooth surface or smooth surfaces. So it is also an example of compound tooth preparation, and it involves surface either mesoocclusal or distocclusal or both the surfaces. So in tooth preparation, then we get different types of terminologies which you should be aware of. These can be asked in your viva. So you can be asked, what is a tooth preparation wall? So the wall is any surface of the tooth preparation that you prepare. So it's regarded as any surface of the tooth which has been prepared. So it can be an internal wall or it can be an external wall, right? So internal wall, what is the definition of internal wall? So internal wall doesn't extend anywhere to the external surface, whereas the external wall, it extends to the external surface of the tooth. So external wall takes the name of tooth surface towards which it is situated. So here in the figure you should see that the external wall in the first figure is facial, lingual, distal, mesial and gingival, because they are extending to the tooth surface. Whereas internal walls here in the figure, first figure, are pulpal wall and axial wall. Pulpal wall is towards the pulpal side perpendicular to the long axis of the tooth, and axial wall which is parallel to the long axis of the tooth. Another terminology which can be asked is, what is a line angle? So line angle is a junction of two surfaces of different orientation along the line, and it is named from the involved surfaces. Like a class 2 preparation which you are going to do in your examination. So when it is asked how many line angles it has, the answer should be 11. And what is a point angle? Point angle is a junction of three plane surfaces or three line angles. And similarly, a question can be asked in your viva, how many point angles are there in your class 2 preparation? So your answer should be 6. So before, as I said, before starting, again you have to check all the armamentarium which you have. Again, it should be, it goes without saying that you are appearing for examination, so it should be very neat, clean. You should know everything, all the instruments you are using should be of good quality, and you should be well versed about every aspect of these instruments which you are using. So be it the nomenclature of the instrument, be it its classification, the metallurgy, the composition of that instrument, the advantages, how to use that instrument, any disadvantage the instrument has, any limitation the instrument is having, the technique of using that instrument, the technique to sterilize that instrument, the sequence in which the instrument is used. So all this you should be well versed of. So this picture shows hand instruments, some of which are diagnostic, some are plastic filling instruments. So they are used with different types of grips. So these grips also you should know. So what are the different types of grip? One is a modified pen grasp grip. Okay, it allows precise control of working end and it facilitates good tactile conduction. Another type of grip is inverted pen grasp grip. So the hand is rotated so that the palm faces more towards the operator It is known as inverted pen grasp grip. So used usually in the lingual, as shown in the picture, it is usually this type of grip is used in the lingual and labial surface of anterior teeth. Another grip is a palm and thumb grasp grip. The handle is placed in the palm and grasped by all the fingers, while thumb is free and the rest is provided by supporting the tip of the thumb on a nearby tooth or the same arch or on firm stable structure. So this is known as palm and thumb grip, and the last is a modified palm and thumb grasp, where the handle of the instrument is held by all the fingers shown in the picture, whose pads press the handle against the distal area of the palm and the pad and first joint of the thumb. So this is more important to control the instrument and provide its slippage. Again, a few rotary instruments are also shown by Dr. Abrar in his earlier lecture. So this particular Burs, this particular rotary instrument, you should have, and it should be a very good one for your preclinical examination. Again, a question can be asked, what is a rotary cutting instrument? So you should know that these are those instruments which rotate on a particular axis to do their work. And what is their work? To abrade or cut the tooth structure. That is the work. How do they do it? By rotation, on a particular axis. So Burs is an example of a rotary cutting instrument which has bladed cutting head. So Burs has a bladed cutting head. It's a rotary cutting instrument. So it can be made up, and you should know something about Burs because again in Viva, the examiners can ask. So Burs can be made up of stainless steel, so which are good cutting, but they are usually fragile. So they are used to cut soft dentine, carious dentine, and used for finishing. Or they can also be made up of tungsten carbide. So tungsten carbide Burs, they have more shelf life and they can withstand heavy stresses. So Burs is made up of stainless steel or tungsten carbide. You can also use the various diamond cutting instruments. So for class 2 preparation, you must keep few good Burs with you. One of which is, as shown in the picture, is 245 number plate. So the width of it is, you always remember, it's a very important Viva question. What is the width of the Burs? So the answer should be 0.8 millimeter. And another important question is, what is the length? So it is 3 millimeter. Because again, remember, we are doing now silver amalgam preparation, whose depth is usually 1.5 millimeter. So exactly half that of this numbered Burs. Okay, so the length of this Burs is 3 millimeter. So before starting tooth preparation, you should check if your handpieces are working, if the motor is properly connected to the electric socket is working properly. All these things you should check before the start of your exam to prevent any anxiety during the examination process. And you are just ready to do the best tooth preparation. Okay. So all these things you should check. You should see to it that your Burs are not worn out. They are not very new also. Don't use a brand new Burs. Okay. Use it for a few times and then use it for exam, because a brand new Burs can also have some problems like run out. Okay. It can be a problem with Burs. If you have not used it earlier, you may not know. So what is run out? Run out is a dynamic measurement of the maximum displacement of the Burs head from its axis of rotation when the Burs is moving. Okay, so when the moving Burs is moving laterally more than what is accepted. What is the accepted clinical run out? The answer is 0.023 millimeter. Okay, that is the accepted clinical lateral movement. What is it? 0.023 millimeter. If it is more than that, then such Burs should be discarded. Why they should be discarded? Because ultimately they will form a preparation which is very wide. Okay, very wide preparations will be forming, and they will cause excessive removal of the tooth structure. They will vibrate more. They will cause more noise. All these things you should check earlier. Therefore, you should not use a brand new Burs without checking how it is working.